And I thought, okay.
Ready? Okay. Thank y'all for coming. Today I want to talk to you about medical billing and medical coding. I work in medical billing, and what I do is I submit claims to Medicare and Medicaid that have been sent to us as a denial, meaning that there was something wrong with the claims, or maybe Medicare decided they won't pay the claim because it's an unpayable claim. But I sit in a cubicle all day and surrounded by all this paperwork and all of these little 3 walls that keep me enclosed, so I never know what's going on. I always only know what the weather's like is if I get up and go out of the cubicle. So I want to get away from that. I want to leave the cubicle behind, and I want a job that would allow me to travel. So one of the things that I can do is work as a traveling coder. A coder signs numeric or alphanumeric numbers to diagnoses so that insurance companies will pay for services or procedures that hospitals bill for. So one way that I can do that is to study for a credential through AHIMA. And AHIMA is American Health Information Management Association, and they are responsible for testing and giving exams based on knowledge for coders. Okay, so one of the credentials for a medical coder is a CCA, and that stands for Certified Coding Associate. It's the basic of all of the codes, and it's the basic of all credentials. But for a starting CCA, the pay is about $36,892 a year. It's very basic, but as you gain experience and knowledge, you're able to move forward and study for a credential as a CCS or CCSP. A CCS is based mainly in hospitals, and their credential stands for Certified Coding Specialist, and a CCSP is a Certified Coding Specialist who specializes in physician coding. Okay, I have traveled before as a nursing assistant. I went to Connecticut and worked a strike at a nursing home, but that job was limited to my position as a CNA, and I haven't been able to find a job like that since. But basically what the company did for us is they paid for our flight to and from the hotels, from the healthcare facility, and they paid for our hotels, and they also paid for doing our laundry, and we were paid $1,100 a week, and then we made $200 extra for our food. So you know, it was a good job, but I only worked for 18 days, and I have never had opportunity to do that again, but it's something that I would like to do. It wasn't until I went to Connecticut to work this strike that I even knew that Connecticut had mountains. We were up on a high mountain, and all around us you could see just this beautiful landscape and all of this. Are you okay? Okay. You could see all of this beautiful land, and there was this dairy farm that sat across from the nursing home, and the people explained to us what it was and that it had been there for a long time. One day when I went to work, there was a llama in the foyer of the nursing home, and it was the cutest, ugliest thing I had ever seen, but it was a llama. A llama, it looks like a camel. And they spit and do all of that nasty stuff. But anyway, so that's something that I have done, and I would like the opportunity to do that again. So a CCS is someone, they would make about $52,771 a year. And this is also based on the education that you receive. If your education is 2-year, you basically fall within the CCA and the CCS or CCSP. And also the Registered Health Information Technology is a 2-year degree as well, but it's a little more involved, so there's a lot more to it than just these other 2 credentials. And they kind of make about the same thing as a CCS or CCSP. But if you really want to get into the field, you can get a job working as a registered health information administrator, and for them, their range is about $68,213 a year. So there is opportunity for advancement, there is opportunity for growth. As a matter of fact, the U.S. Bureau of Labor Statistics states that medical coding jobs will be available and be well above the expected amount of job growth versus any other job, simply because people are always going to be sick, bills are always going to have to be paid. So, you know, it's just a great opportunity. Now, I didn't just decide that I wanted to be a medical coder. I actually met a girl. Her name was Martina. We met 2 years ago, and during that time, she was studying for her CCS, and she has since passed. But I talked to her recently and was trying to just get some information about it, and she was just telling me how she got started, that in 1997, it wasn't necessary for medical coders to be credentialed. You just kind of fell into the job. You just looked. It was something that she came across when she was working in billing, and she explained to me that one of the employees explained that all of the medical coders there were just homegrown. You kind of just went into it, and that was your job. So by 2003, it became apparent that coders needed to be credentialed if you want to move further. So that's what she did. She became a CCSP first and worked in the physician's office. By her having those two experiences, working in physician and hospital, it gave her the opportunity to go into traveling. Her first assignment was in California, and while she was there for about 6 months, she worked 10 different cities. And the only thing that she didn't like about it was the fact that she would have to drop everything that she had to, anything that she was doing at the time. When her company needed her to move, she had to move. And then she missed her family a lot. So she said that's kind of why she left it alone for a while, but she misses it. And so she came back home, and then she started working for Kaizen. That's an insurance company. Some coders work in insurance because insurance companies want to make sure that what they're being billed for is actually billable. So, you know, that's another career path that a coder can take. You don't necessarily have to work in a hospital or a doctor's office. You can work for government. You can work for Medicare, Medicaid. So there's just a lot of opportunity there. So Martina, once she did the CCSP, she did the CCS, so now she's taking her bachelor's degree for registered health information administrator. So she's well on her way to a great paying job. And as a matter of fact, one of her traveling companies has called upon her to take a charge master position. And a charge master is a list of diagnoses and procedures that hospitals bill for. It can be for the room charges, because everybody gets charged for everything at the hospital. So they have this list or schedule of fees and prices for everything, and so she would be able to manage that. And she had never done that kind of work before, but because of her experience, the company thought that she might be able to pass this exam. So she took it, and she passed. So now she's going to travel again, and she's going to go to Tennessee and work with a proctor. And after working for a while, if everything goes well, she'll get this charge master position. And for her, that means that she'll have an annual income of about $160,000. So it's just the knowledge, your knowledge base, and you know how far up you want to go in this field determines, you know, where you land and the level of things you can do. Me personally, I want to be able to go and see cities that I've never seen before. I've never been to New York. I would love to go shopping in New York and go to, you know, Fifth Avenue or Bloomingdale's, or maybe I want to see Niagara Falls, or go to Las Vegas and do a little gambling. You know, it's legal there. So, you know, just know that the opportunity is there, and that one day I'm going to do just what my poster says and leave the cubicle behind. Thank you.